Thank you. Thank you very much. It's a great pleasure and honor to be with you today. Actually, as it was mentioned in my biography, and I want to stress it back, that I served in 8 countries, maybe more. I served means I worked as a physician. My work is a physician. I'm a medical doctor. I care about patients. My work is a patient come and complain, and my job is to relieve this complaint. This is why my research and my work is centered around the patient benefit, the patient need, and how to treat the patient. I do not use $10 terminology of science, which is heavy words, but at the end of the day, it is great for the sake of science. But the patient does nothing, the patient benefits nothing on the short term and in the long term. We will talk about neurodegenerative diseases, which is the source of inspiration in this research. But actually, I would like to spread a new theory or an idea. We need to discuss it. We can discuss it. As I said, it is a theory. Every theory is subject to be correct or wrong. So all the feedback is welcome, and all the criticism is welcome. And any modification or something to build on it is more than welcomed. Neurodegenerative diseases, I can claim that no family in the world does not have at least one patient suffer from neurodegenerative disease. Either neuromuscular disorder, cognitive disorder, Alzheimer, Parkinsonism, dementia. Every family, you must find somebody suffer from a type of neurodegenerative disease. It's a big industry today, you can say. If we know that the caregivers in Australia, for example, represent around 12% of the manpower, Australians, 12% of the Australians work as caregivers for the elderly who suffer from neuromuscular disorders or the elderly or the geriatric diseases. This is one of the causes that made me focus in this research about the neurodegenerative diseases, especially the neuromuscular disorders. I would like to define every sickness, every disease, as a process of degeneration. And I'd like to describe every healing process as a process of regeneration. So I can summarize the textbook of pathology in one word: degeneration. And the book of clinical medicine in one word, which is regeneration. Degeneration, some of them are nice degeneration. We have a very good degeneration, which is a process of apoptosis, which is responsible for renewal of our body cells, renewal of our skin, of our organs, of our vital tissue. But there are 2 bad degeneration processes which are resulting from whatever factor to stimulate the degeneration. The regeneration also have 1 type bad and 2 types good. The good is the replacement of the tissue. The good is the healing. But the bad, when it is over regeneration and start to be cancer. The master of all of this process is the cell. Simply the cell. The cell is our functional unit in the body. All our biochemical reactions in our body, all our hormones, all our actions, everything. Let me summarize by saying everything. All the secret lie inside this cell. Heart, what is the heart? It's some types of cells. What is the brain? It's some types of cells. Liver, it's some types of cells. These cells, each one of them function properly, the whole organ will function properly. So, the focus here is on the cell. What is in this cell of power. Why I say the cell is that very important. First, let us see how big the cell is. Cells are very small structures. They range in our body from 5 micron to 140 micron. So the biggest cell we can find in our body is 140 micron. Micron, which is very small. So if you see here, it's a part of your skin. If we take 2 millimeters of your skin and we take 10% of it to 0.2 millimeter, and we go to find the cell, the 20 micron contain 3 cells. The cell structures inside the cell, the biggest one we can say, like the mitochondria, it will be 2 microns. And if we take part from the mitochondria, it is 0.2 micron, which is about 200 nano. And 20 nano is a particle of the particle. So what we are talking about very minute structures. These are the secret of life. We should not forget that the cell is 2 things started as either sperm or ovum, or both of them combined together to start the life, giving us the zygote. The zygote in 2 days only multiply, become 2 cells. The 2 cells in 1 day only become 4, 8, 32, 64, and so on, till surprisingly we will find the 1 cell which started by 2 halves became 26 billion cells in 9 months, with a rate of regeneration of average 96.3 million cells a day. Not only multiply in number, but also specify in function. Some of these cells became a heart, some of these cells became a liver, some of these cells became a kidney, some of these cells became a brain. So specialization in function with increasing in the number, making for us the sweet baby in 9 months. What kind of power is this? We are all here doctors. We know where this happens. Does this happen in a hostile environment or a friendly environment? Is the environment where the zygote is full of nutrients, full of the ways of comfort, or it is a hostile, it is very hostile environment. It is a fallopian tube. This happens in the fallopian tube. And all these stages happen in the fallopian tube. But let us go back to the constituents of the cell. The DNA, the macrophage, the mitochondria, Golgi bodies, smooth endoplasmic reticulum, rough endoplasmic reticulum. All of these structures doubled in 24 hours. Where? Where did this come from? If we think about it deeply, we'll find it's a mission impossible to make billions of amino acids to form the DNA, to duplicate the DNA, and to duplicate all the structure of the cells, and duplicate the cell membrane itself in 24 hours. And it didn't do this and stopped. It continued and continued and continued continuously for 9 months till it became a baby. And after the baby is born, it didn't stop. It's continuing for the baby to grow up. So it's absolute power. Let me use the first word which I said it in the lecture, which is regeneration. It's absolute power of regeneration. Regeneration with regeneration with regeneration with regeneration, absolute regeneration. In intrauterine. Then the baby is born and started to grow up. The growing up not with the same rate as the intrauterine. Because here started the adverse factors, the degeneration factors. What are the degeneration factors here? Baby might fall down. Mother may be not giving food, milk, in proper time, regularly. There is no regular feeding for the baby. The baby cries. The baby suffers from some diseases. Some bacteria is around him, so started some factors of degeneration, but still the regeneration power is so fast. regeneration and regeneration and regeneration in front of some factors of degeneration, and continue growing till reach the adulthood, where there is an equal balance of regeneration against the degeneration. Here he does not increase in size. There are no more functions added to his organs. But still there is regeneration against factors of degeneration: pollution, infection, work, stress, bad lifestyle, smoking, lots of factors of degeneration, and again lots of factors of regeneration, but it's balancing. Because in this age, in this posture, he is balancing. He is normal. He is not sick. He is not suffering. With advancement of life, the factors of degeneration increases, and the factor of degeneration increase and regeneration decrease. And this is what we call it aging. Away from the religious beliefs and away from the superstition ideas we have in our minds, can we call death absolute degeneration? Absolute degeneration happened in a vital organ or in a place where life is dependent to continue? Can be. We had this discussion a lot in China, very long discussion about this in China. And we found out, for example, the AV node, which is, without the AV node, the heart will not beat. The brain can stop, which is clinical death, but still the person is alive. The AV node, if stops, the heart stops, even if the SA node is working. So one of these vital organs to degenerate absolutely so that we find the person dies can be. Look with me to these wreckages we are witnessing here. This is a city destroyed by Alabama tornado, 2011. And this is a city destroyed by bomb, 1944. And this is city in Indonesia was destroyed by earthquake, 2004. Can we see any difference between the three cities in destruction? The three cities are destroyed. The end result is what? Destruction, mass destruction in all the infrastructure and all the buildings of the city. In addition to might be some casualties, maybe somebody died or somebody injured. What I want to say here, today in medicine, and the way we studied medicine 30 years ago, all the time we are running after the etiology, the cause. The three cities are destroyed with three different causes. The result is one, destroyed city. Inflamed cell by radiation, by chemicals, thermal, viral, bacterial, genetic, all miscellaneous. These are the causes we studied in the pathology that causes inflammation. The result is inflamed city, inflamed cell. Let me use a better terminology, degenerated cell. The cell lost all the factors inside it, or some of them, we cannot know. Let us look to the treatment we are giving today. What do we give today as treatment? Inflamed cell, we might give anti-inflammatory. Yes. Bronchitis, more than 3 days, with some fever. Culture of the sputum positive. Antibiotic might be. Antibiotic does what? Remove the cause. We are running after the cause. Think with me about all the diseases we practice every day in the clinic. I told you in the beginning, I'm a medical doctor, I'm a clinician. I care about the patient. When I write a medication for the patient, will this medication give the patient healing? No. All our medication run after the cause. All our medical books run after the etiology. After 3 days, 4 days, the patient still coughing. He come back to the clinic, we culture the sputum again, the sputum is negative. But the patient still coughing. Yes, you are still having inflamed bronchitis, so go and heal on your own. I might give him something symptomatic, something for the cough, antihistamine, something symptomatic just for relieving the symptoms, but I will not help him to regenerate. While in this city, if I remove the earthquake has gone, but the city is destroyed. Tornado has gone, the bomb has already bombed, but still it is destroyed. And this is the principle which I'm running after in my lab. The principle of regeneration. I want to restore a function for the cell. I want to restore integrity of the cell membrane. I want to restore function for the mitochondria. I want the